My name is Harry Kim, and this presentation is called Characterization of Population of Persons Who Use Methamphetamines in Southwestern Ontario. First, we'd like to acknowledge our funders and community partners. And you can pause the video to look at the learning objectives. Now, this study finds itself within the first year of a 4-year project called the Methamphetamine Harm Reduction Study, which aims to develop and implement harm reduction strategies in the hospital setting for people who use methamphetamines. Methamphetamine use has been on the rise across Ontario and Canada, and these individuals are at risk of infection as well as morbidity and mortality associated with substance use. And this is important because currently hospitals have an abstinence-based strategy and there are no harm reduction strategies for substance use specifically. And so for the first year, we wanted to describe the cohorts, get an idea of their self-perceived health, as well as the utilization of services. And to do so, we administered quantitative questionnaires related to substance use, self-perceived quality of life and health, and service utilization, recruiting in adults with experience using methamphetamines and accessing hospital services. And these individuals were recruited at places where methamphetamine use was identified, such as homeless shelters, community and mental health services, and safe consumption sites. And these are some examples of the surveys that we used. To give a brief overview of our population, there was a 59% split of white versus Indigenous population people, 66% identified as male compared to 32% as female. And this gender split and majority white population of methamphetamine users has been described in similar studies across North America. The mean age was 35.5 with a standard deviation of 12, and the mean age of first methamphetamine use was 25 years. We also want to report the self-reported mental health conditions. The vast majority reported having any condition, and these are some of the most prevalent, including anxiety, ADHD, substance use disorders, psychotic disorders, and mood disorders. Regarding substance use, just in general or during hospitalization, 93% reported current substance use, among which methamphetamine, opioids, and fentanyl, marijuana were the most prevalent. 45% reported injecting drugs, and 23% reported injecting drugs daily. And when we asked about whether they used substances during a hospitalization, 55% said yes, and included substances such as methamphetamine, opioids, marijuana. And when we asked where specifically they used the substance, it was either in the room, under the sheets, in the bathroom when the nurses weren't looking, or going outside for a smoke, for example. Next, when we asked about what type of services that they accessed in the last 6 months, actually first we'll see that this population has a high rate of hospitalizations in the past. The vast majority have reported at least one hospitalization in their lifetime and reported substance use while hospitalized. Moving on, when we asked what type of services that they used, it was social work, caseworkers, addiction medicine, primary care provider follow-ups, etc. And when we asked about the same-day visit shelters or drop-in centers, more specifically, we'll see on the right table over here, they use safe consumption sites, homeless support services, and in the other, these can include food pantries and other day services that don't include overnight shelters. And lastly, we also measured the self-reported quality of life measures because we thought it would be important to understand how these individuals perceive their own health and their quality of life. And these are the 3 surveys that we used for this category, which had broad categories of how they feel integrated into society, how they feel about their own health and well-being, whether that's physical, emotional, or mental, and how they're satisfied with their life situation currently, including their leisure, their family relations, their social relations, and their own health. And throughout all of these surveys, we saw that the participants scored lower than the normative populations, general population scores for all categories. And this may or may not be obvious or a finding in itself, but we thought it was important to capture this to describe the cohort, not just in terms of substance use or mental health, but also their self-perception. And all this being said, we want to move forward into the next years of the study using this information, as well as qualitative interviews collected in separate arms of the study, to ultimately develop harm reduction strategies and try running trial runs in the hospital setting to see what can work to mitigate substance use in the hospital setting. To learn more about this project, here are some of the references. The first links to the launch event, which has a detailed video about the project. And to learn more, Dr. Cheryl Forchuk is the principal investigator. Thank you very much for your attention.